And can I ask you then about what you call compassionate mandatory care? This is something that the Premier David Eby has talked about expanding in the province, and the doctor who's heading that push is speaking at the UBCM as well today. When discussions around this, first started, we heard a lot of concerns from mental health advocates that the evidence shows that it doesn't work, that people don't necessarily get better afterwards, and that there is recidivism, or that there's, that they do end up needing care once again. But we seem to be at this point where we're discussing it. They're pursuing mandatory care because people are seeing the issues that they're, on the streets. So how do you see the conversation having moved the dial that way to support for mandatory care? And what do you say to concerns that, the evidence shows it doesn't work?
Couple of things there. First of all, we have about 189 municipalities that are represented here at UBCM in Victoria. And the role of municipalities, and all municipalities, are forms of, infrastructure, services, community development. What type of additional economic development can we bring to our communities? Municipalities were never designed specifically to deal with mental health, addiction. Those are items which are outside municipalities. The only way that we can truly deal with them is we increase our RCMP, we increase our bylaw, we increase our social services that are within our communities, which become a substantial cost. We currently have in Kelowna 15 individuals who we know have continually cycled through the system and have over about 1,350 police files attached to those 15 individuals. We recognize that there's systems that we've tried to set up for those individuals who have the ability to look at helping themselves and wanting to try to find a better path forward. And we want to be there to try to maintain that type of supportive housing, maintain that type of health care and assistance for them. But there is a specific group of individuals who regrettably continually cycle through the system due to mental health or due to drug addiction. And with the compassionate mandatory care, the level of acceptance, I believe, of individuals is getting thinner, recognizing that there is a true need to help these individuals find a better path forward. And that's what we are suggesting to be done, establishing a proper process to find them a better path forward.
Do you worry, acknowledging the issues that the downtown businesses and the communities are faced with, do you worry about increased stigma for people who are unhoused, people who are dealing with addiction as a result? Let me just read this email to you that we've received from Teresa, who writes, this can be solved if they would make gated communities for the ones that have received housing, or use electronic devices to keep them in their places during the night. And you can see, the concern there around perhaps criminal activity happening overnight, and that's what she's writing about. But I wonder if then there are concerns around the way people who are struggling with these issues are viewed.
Well, I'm going to share a story that happened in Kelowna then to probably make it a little bit easier. We established 180 tiny homes. In the first round of introduction, the first 120 that went into those tiny homes, through a process of care, through a process of working alongside them, through a process of just finding a better path forward. And within that first year, we had 66 individuals who either found supportive housing, who either reunited with family, or also went to Interior Health and found a better path forward. So this isn't about putting someone in a position to kind of be locked up or locked away or something along that lines. This is a very compassionate way to say, there are a certain number of residents, a certain number of individuals within all of the communities, the 189 that I said, within British Columbia and across Canada, who need a better path forward. And this mandatory compassionate type of care, not care that only lasts for a week or 2 weeks, something that is going to be more solid and put them on a better path forward, Because as I mentioned, as municipalities, it's not, what we manage day in and day out, yet it is expensive, and we need assistance in managing it better. So that's why we're coming to the federal government and also the provincial government to assist us in managing the structure moving forward.